In the heart of the province of Batangas lies a leading organization curving professional excellence, aiming to be an undisputed leader in promoting the progress of the medical technology profession. This is the Lyceum of Batangas University, College of Allied and Medical Professions, Medical Laboratory Science. Hemoglobin determination. Our objectives for this experiment is to perform the hemoglobin procedure satisfactorily and to determine the hemoglobin concentration in the patient sample. Hemoglobin. The iron-containing substance of the red blood cell is composed of simple protein called globin and a red compound called heme, which contains iron and porphyrin. Each erythrocyte contains 200 million to 300 million molecules of hemoglobin, which combines chemically with oxygen to form oxyhemoglobin. Hemoglobin also combines with carbon dioxide. These two capacities enable the blood to carry oxygen to the tissues and carbon dioxide to the alveoli and thus to the atmosphere. Our materials and equipment, together with the reagents for this experiment, are the following: sucking tube, Sally pipette, Sally tube, hemoglobinometer, small stirring rod, 0.1 normal hydrochloric acid, distilled water, and a blood sample. One method that can be used in hemoglobin determination is colorimetric method. And under colorimetric method is acid hematin method, which has the principle of when hemoglobin reacts with an acid like 0.1 normal hydrochloric acid, it is converted into acid hematin that is brownish yellow in color. The color is matched with a standard. First, place 0.1 normal hydrochloric acid up to Mark 2 on a gram scale of a graduated Sally Halage hemometer. Draw a blood sample, either capillary or venous, into a Sally pipette up to Mark 20 cmm. Wipe excess blood from exterior of pipette with tissue. Transfer blood sample into the hemometer tube containing the acid and rinse the pipette for at least 3 times. Stand for 10 minutes at room temperature. Place the tube into the comparator block. Add distilled water, drop by drop, until the color of the diluted sample matches that of the hemoglobin standard in the comparator block. Read the meniscus directly on the gram scale of the hemometer tube. With conventional unit, normal values for men can range from 13 to 18 grams per 100 ml. Women with 12 to 16 grams per 100 ml. Newborns 16 to 23 grams per 100 ml. And children with 10 to 14 grams per 100 ml. Hematocrit determination. Our objectives for this experiment is to demonstrate the proper hematocrit procedure and to know the importance of the test. The packed cell volume, or PCV, hematocrit, is a measurement of the ratio of the volume occupied by the red blood cells to the volume of whole blood after centrifugation in a sample of capillary or venous blood expressed as a percentage. It closely reflects the hemoglobin and RBC values. The hematocrit in percentage points usually is about 3 times the hemoglobin concentration in the grams per deciliter, when the RBCs are of normal size and contain normal amounts of hemoglobin. Clinically, the hematocrit is used to screen for anemia or other red cell volume alterations. In conjugation with an erythrocyte count, the hematocrit is used to calculate the mean corpuscular volume. The hematocrit is also used in conjugation with the hemoglobin concentration to calculate the mean corpuscular hemoglobin concentration. Our materials, equipment, together with the reagents for this experiment are the following. Capillary tubes, can be plain or heparinized. Hematocrit centrifuge, hematocrit reader, sealing clay, 70% alcohol, and lancets. The method that we use in this experiment is the microhematocrit method, which has the principle of a small amount of whole blood is centrifuged to determine maximum packing of erythrocytes expressed as PCV or HCT. First, fill at least 2 capillary tubes approximately 2/3 full. If using tubes with a colored ring at one end, fill from opposite end. In a vertical position, seal the unfilled end or the end with colored ring with sealing clay. Make sure that it is completely plugged to a depth of about 2 mm. Place the 2 tubes in the radial grooves of the microhematocrit centrifuge head exactly opposite each other with sealed ends securely against the gasket. The capillary tube should be sealed securely because incomplete sealing of the capillary tubes will give falsely low results in the process of spinning because RBCs and a small amount of plasma will be forced from the tube. Place head cover on the centrifuge. Tighten securely and close top. Centrifuge for 5 minutes. As soon as the centrifuge has stopped spinning, open lid, remove cover, and remove capillary tubes. Determine the results using the microhematocrit tube using device. The hematocrit may be expressed either as percentage or as decimal fraction. The normal values in terms of percentage at birth 45 to 60%, 1 year 27 to 44%, women 36 to 48%, and men 40 to 55%. Thank you for watching this video. I hope you learned a lot from this experiment.